Good. All right. That looks good. All right, everybody. So I'm going to go ahead and get started. So my name is Bradley. I'm going to be your director of student affairs. So I'm going to be doing these lectures from now on. I may be pulling in some guest lecturers. Feel I'm probably going to end up pulling in one of my mentors, Dr. Bowers, to do another lecture that's going to be coming in pretty soon. Right off the bat, though, does anybody have any like specific questions about VSLO or SLOEs, or do you want me to just go ahead and get started? All right. So I'll go ahead. This is residency application doesn't move slow. This is actually adapted from a presentation that was given by our very own Dr. Sarah Turley last year. So I'll go ahead and get started. So these are our new board members for this next year, and I hope that you get well acquainted with all of their faces. All right, and we'll move on. So today's agenda, we're going to talk about sort of the terms that you need to know, the purpose of audition rotations, talk about the SLOE as well, which is what you'll be getting from your audition rotations. And then we'll talk about the kind of the timeline of things that you can expect, do a little bit of a VSLO walkthrough on what it looks like, and then we'll go on to start creating a program list. So I am very intimate with this process because it's pretty much what I have been doing for the past year. And so I have a little bit of knowledge, having gone through it very recently, and so I hope to share that with you guys. So this is our terms. So VSLO or VSAS, as it was called, is the Visiting Student Learning Opportunities. It's through the AAMC. And it's this application service to secure your fourth year and audition rotations. So not only is it for your audition rotations, it's also for electives that you may want to do that are away electives. The term sub-I is generally kind of defined by your school. You have to meet their criteria, 75% inpatient, must have residence, direct participation in acute care. Your school will have its own set of these criteria. So your auditions and your away rotations, those are going to be your big deals. You have to be on point during these audition and away rotations because they're going to be at the residency program that you're interested in. And so cord guidelines kind of suggest that you do 2 to 3 audition rotations. Now I did 3. I also know people who did 2, and they are completely fine and they're loving their life right now because they are not, slaving away as a medical student on their audition rotation. But you know, you can choose if you want to do another one, like I did. Um, Now let's talk about eSLO versus letter recommendation versus letter of intent. So your standardized letter of evaluation is widely known as the most important thing on your application as an EM applicant. So this is incredibly highly valued, and we'll get into kind of what goes into the SLOE later, but just know that during the entire month that you are on rotation, you are being judged. So make sure to give a good face. So Eris used to be where we actually compiled all of these things and compiled all of our information and give an application. But very recently, I'm sure all of you know that we have switched to residency cast for our applications. So goals of the audition rotation. You want to learn more about the program, the location, and the attendings. Programs are checking you out as much as you're checking them out. So bring enthusiasm to these rotations. Okay, they want to see that you're eager to learn, and they also want to know if you're going to kill anybody on the rotation. So practice safe medicine and bring your A game. Uh, this is your chance, though, at this time to learn emergency medicine and what exactly makes it tick. So this is your chance to kind of have a little bit of a buffer, when you're not quite a resident yet, but you're also kind of told to go out on your own and come up with your own treatment plans. It's kind of your chance to practice all of these procedures that you're going to be doing for the rest of your life, be able to get a lot of hands-on experience, and don't say no when somebody asks you, hey, do you want to intubate this patient? Hey, do you want to go do this lac? Hey, do you want to, don't say no. All right. So basically, what do you not want to do on your sub-I is look like this kid. You do not want to be on your phone, uninterested. You don't want to be kind of showing that you don't think that you're going to learn anything from them. And also, do not show up late. Let me tell you, every bit of advice from every program director that I've talked to is these students who show up late basically are dropped off immediately. I don't know why. I understand like things happen, but aim to get there early. You almost kind of want to aim to get there early before the resident even gets there. So now let's talk about SLOEs. These are, again, the most important part of your EM application. And there's different terms for different types of SLOEs. So your E-SLOE is going to be the one that you get from a program. It's going to be from a residency program. So when you go and do your audition rotation, it has to be at a residency program that you get this E-SLOE. Now, your non-residency based SLOE and your O-SLOE, which is your off-service SLOE, which is from some other off-service rotation that you've done. Generally, it's like internal medicine, or it can be, psychology or psychiatry, sorry, or it could be really anything. But it's your off-service. So you want to get this one to kind of your best friend that's outside of emergency medicine. That's the one you want to get your off-service or O-SLOE from. Then your non-residency based SLOE is going to come from your core EM, or if you're like Manny, who I was talking to, you did an EM elective. So you can get a non-residency based SLOE from an EM elective during your third year. Now, do you really want it from your third year? I don't know. Maybe your knowledge is not quite there yet, but uh, you can obviously get that from your core EM rotation and it'll be great. As far as your subspecialty SLOE, I mean, you can kind of dabble in that. That'll come if you go on to an away rotation elective, which I'll talk about in a bit. And you do an EM subspecialty elective rotation. But generally, these are kind of like hard to come by. Uh, so yeah, I'll move on now.
Bradley, we have a question in the chat.
Oh, sure.
Um, should you have all four of these types of slows?
No, so you don't have to. Generally, people go for an O slow and then go for 2 to 3 E slows. Now, these E slows, again, kind of like I was saying, are going to come from these residency programs that you're going to during your away rotations. Um, at least how I set it up was I had an Oslo from my IM rotation, and then I had 2 E slows from my away rotations. And most um, I'll say most residencies want you to have at least one ESLO. Now, what you can also get is also called a narrative letter of recommendation. Those are generally kind of the weakest form of letter of recommendation, but you can get those. Those would not even be an off-service slow, but they would be written by, maybe a mentor that you had prior to medical school, or maybe even during medical school, or maybe one of your faculty at your school really, really wanted to go to bat for you, and you wanted to get a narrative letter of recommendation. So you can do that as well. Just know that those are kind of seen as like weaker letters of recommendation.
We have
Okay,
another question in the chat.
sure.
So I did my core EM rotation in third year itself. Would you recommend a non-residency based OS based sorry, would you recommend a non-residency based SLO from the attending I worked most closely with over an OSLO, in addition to hopefully two ESLOs?
Yeah, so you could actually do both. So you can do the non-residency slow. Get that from the EM doc that you worked really close with. Then you can grab your OSLO during your either, somebody you were close with that wasn't on your EM rotation during your third year, or you can grab it during your fourth year during one of your required rotations. Any other questions?
We're good right now.
Okay. So this is kind of what residency cast looks like. I know that the third year has pretty much just got access to this. But this is what it'll look like when it's completed. Your evaluations are going to go in this section on your program materials. And then when you click on this, I unfortunately couldn't show you because it had all of my information in there. But when you click on this, it'll go through the different options of like eSlow, your OSlow, or sending all these things. And it'll say, send slow to this place. And that's where you put the email in for the person that you're going to be getting your letter from. And then they go from there. It's actually really easy for students now to request a letter of evaluation. So I think that's something that Residency Cast has done really, really well. But I'll move on now. And then this is kind of an example of what goes into a slow from an evaluator. And then I believe this one is a form of an e-slow. Yeah, so at the top there, it's a form of an e-slow. And so, you applicant's name, everything, what sources did you use, background information, evaluation of student part A, are they able to perform a focus history? Are they able to generate a differential? Are they able to formulate a plan? And can you trust them to do this? Then in part B, you kind of have your intangibles, your compassion, sensitivity, respect, receptive to feedback, able to be taught, dependability, again, punctuality, and attendance. This is a whole point in your evaluation, which is crazy to me, but this is a whole point is literally, can you show up on time? So that's why I made that point earlier. But um, responsiveness to completing administrative tasks, interpersonal communication skills, you get the point. Um, and then down here is kind of the big thing that all of the programs look at. And it's how highly would you estimate the candidate? Are they in the top 10%, the top third, the middle third, lower third? Or would you not even rank them? So this is kind of the thing that they love to look at, these program directors. And then you kind of have some other information here. And this came right out of Emron Court Student Advising Guide 2022, 2023. Manny's putting it up on his screen right now. So this is us at Nashville. So make sure to join us on our upcoming one. I have a little bit of a flyer at the end so we can learn about that later. But this is us at Nashville at our conference. So make sure to come by and see us because we're all fun people. And here is a couple of examples of a SLOE. Um, I'm gonna send this document out, so I'm not gonna go ahead and click on it and show you an example and all these things. But just know there's a couple of examples, and I already kind of went through an example with you just a moment ago. So now we get into audition season. So this is your timeline. VSLO is going to open. Most programs will be available in March. Summer is early in January, and I believe Manny had an update very recently as to when students can get access to this.
Hey guys, yeah. So Bradley was going to go ahead and walk us through VSLO, what it looks like to apply, what you would normally see. However, they are getting a makeover. How much of a makeover that is from previous years is TBD. We will be getting access to it as students on January 20th, I believe, and residency programs will be getting access to it on January 13th. So keep your eyes out open for that, and let's have a good VSLO season.
Okay, thank you, Manny. So when these open, you need to be on it. And you're going to sign up for an email that's going to let you know when the program is starting to accept applications. So pretty much right then you kind of have to like drop it because honestly for me I waited a little bit and I regretted it. I ended up not getting a rotation spot actually at my number one that I wanted to go to. It still ended up getting an interview there. Hopefully I end up going there, but this is kind of the thing that happens. They fill up very, very quickly. So, uh, next, we're going to move into May, June time. This is going to be taking your COMLEX 2, or if you choose to take it, Step 2. Um, there's kind of varying information on whether or not you should definitely take Step 2, or if it'll just be a little bit of an extra test, that you have to go and pay for and you have to study for. And honestly, I feel like for a majority of EM applicants, I think a COMLEX 2 is going to be good enough. I don't think that you have to take step 2, but I know that some programs, if you're wanting to apply to like a highly competitive program, you may want to take step 2. Um, we'll move on into kind of July, August, September, and really all the way into January is kind of your audition rotations. But you should try to have 2 audition rotations done by like September. Basically, whenever you submit your residency cast, you want to try to have 2 audition rotations done so that you can have 2 e-slows. Um, but residency cast will actually open in late September, although this past year it actually closed, sorry, late September, but the residency programs were not able to see it until October 14th. So that's how they kind of the timeline is there. Now, moving on to November, December, January, these are your time that you're going to have, or sorry, even late October, you're going to have interviews. And let me tell you, I feel very tired from doing a lot of interviews. I feel very, very tired. But I feel like the more you do, kind of the better you get at it. And really, the magic number that was from this past year was 14 interviews. So If you get 14 interviews, then you have basically a 100% chance to match into EM. Now, around February, the rank list opens and you submit your rank list. And then in March, we have the match. Any questions on kind of the timeline of things? Because I know that that can be a little confusing.
Yeah, I have a question.
Sure.
Oof. Do you need to have all your eSLOs and everything in before you transmit your application? Or if you're doing like a away or something at, let's say like November,
Yeah, yeah.
can you
So,
submit that?
yeah, you can definitely submit that. Now, they will automatically get an update that says you've updated your residency cast. But it may be good for you to kind of like, if you're really interested in somewhere, send them an email, say, hey, I've gotten this new eSLO done,
Okay,
take a look. So, yes, you can continue to submit them after. However, it's very much advised to have at least one eSLO submitted whenever you submit your application the first time. So in late September.
thank you.
Yeah. So, now let's talk about vSLO, which is kind of where you guys are at the moment. If you're a third year. Now, if you're a first or second year that's joining the call, fantastic. Or if you're a fourth year, you've already done this. I don't know why you're here. So, uh, most begin accepting applications in March or April, kind of what I said before. Um, Average student kind of applies to like 5 to 7 programs. I think I applied to like 6. I ended up getting 3 of my 6, and so I was set. Um, don't over apply to these. They come with an application fee. Don't waste your money. Um, Cord recommends you get about 2 to 3 audition rotations. And I kind of said that a few times, but I want to make sure that you guys remember. So I'll say it multiple times. And then requirements here. This is something that you're pretty much gonna just see as you get your audition rotations, and each one is gonna be different. I would recommend you have all of these kind of things saved on your computer because every single one of your audition rotations is gonna ask for this stuff. And for some reason, even though it's in your residency cast or even though it's in your vSLO, they don't have it. So you're gonna need to resend it. So I recommend kind of saving all these things.
Not to cut
Now,
you off, Bradley, but I would get that stuff together sooner rather than later because some of them you're required to submit before you can even submit the application. So if you just like get all of this stuff ready when these applications open on day one, you'll have everything to submit. Some of them will want a lot of this stuff sooner, and a lot of some of them will want it like when you've been accepted, but you don't want to not have like 2 or 3 pieces of the puzzle, and that puts you like a few days behind submitting it. And like Bradley said, you have to apply to these and like really be on top of when these dates open because spots go so fast. So I don't want you guys to kind of get on there and then realize like, oh, I never updated my N95 thing. And that's something that y'all could be doing in the next few months to make sure you have like all of the information you need when you sit down to apply to these places that you want to go to.
yeah. Thank you, Nicole. Really appreciate that. So yeah. Um, This is kind of what vSLO used to look like. I don't know what it'll look like going forward, but I imagine it'll probably look something like this. And then as a disclaimer, kind of in all caps down here, not all programs use vSLO. So even though you have all of your stuff put into vSLO, again, make sure to still have it, just as Nicole was saying, because, you know, you may need to submit all of it really quickly to this program that you want to go to that's not going through vSLO. So,
Bradley, we have a question in the chat.
sure thing.
Can you use letters of recs from a third year preceptor instead? Have gotten really close with some, but then I just saw as of right now, Nicole responded. So perfect timing on that.
I
All
meant
right.
for VSLO, not for your residency cast.
Yeah, yeah. So for VSLO, you definitely can use those letters of recommendation that you've accumulated.
Okay, instead of I mean I have an EM advisor, she's fantastic too, but I was just curious if, certain things weigh more or if it's kind of
For VSLO, not really. In general, for VSLO, like they kind of give I, at least from my experience, it's kind of a first come, first serve. Like they're not really looking super hard at your application. Like they may give it a quick glance over. Again, I imagine. I don't know. I haven't been inside these places to see how this is done. But I would say it's probably more of a first come, first serve. I don't think there's like a weight to whether or not a letter of recommendation is coming from your advisor or from someone that you've worked with.
thank you.
I think
Yeah.
some are very specific, Rob. Like some will say like department chair, some will just say a letter of rec. So like just be specific and read the requirements and kind of see what you need from that standpoint.
Okay, great.
Perfect. So, as far as your, contact details, make sure to give them an email address that you check. Because I actually made this mistake. I gave an email that I didn't often check at the time, and I had an email sitting in there saying, "Hey, this one's open," and I kind of let it sit in there for a little while, and I ended up not getting to rotate at that place. So don't be like me. Do good. Uh, but yes, as far as your address, yeah, some programs will mail you stuff. It's pretty cool. It's free stuff. And then for the short bio, you can fill it out. But yeah, kind of what I was saying before, like I don't think they're gonna put too much credence in it. And honestly, like whenever you go on your audition rotations or on these electives, they're gonna ask you about yourself. Like they're not gonna know anything about you really, like right off the bat. So yeah, kind of inputting all of your core rotations into this vSLO. Uh, Again, your core rotations are kind of going to vary depending on where you go to school. So they have a lot of them. Just make sure to kind of know where your date completed are. Do I think most schools probably use new innovations to track that. So if your school does use new innovations, make sure to check and kind of see when those rotations, your third year rotations have ended, and then you can input them in there. But if yours does not use new innovations to track your schedule, then I unfortunately am not the most helpful when it comes to that. So. Yeah, so this is actually really cool. So when you're looking for electives, you can actually look for EM adjacent electives, like subspecialties of EM. And these are kind of a good way to go to a program and kind of check it out without having to go and do an actual sub-I and be evaluated constantly and be working constantly. This actually, when I did my away rotation in Texas, there was a wilderness medicine rotation that was getting to have like the time of their life during my rotation when I was working in the emergency department every day. So, be on the lookout for some EM adjacent things, and you can also get one of those subspecialty letters that I had talked about before from these. So you can kind of search, go into like this active internship. You can go to see toxicology, ultrasound, EMS, resuscitation, simulation. Again, like I said before, wilderness medicine. There's a ton of these kind of subspecialties in emergency or fellowships that are really happy to have students. And they are a really good way to kind of check out some programs. Um, so moving on to the application. So the essay, most places that you apply to on VSLO require that you write some sort of letter of intent, or sort of a letter of why you want to go to do this rotation. Some do not, but most will have you give this letter of intent saying why you would like to go rotate there and why you think you would benefit from being at their program. All this other stuff is just kind of requirements that you guys can fill out. And a drug test, because, every year now, I guess, we get drug tested. So this is kind of what one of those emails will look like when you're applying to places on VSLO. So it'll say, great news, one or more of your saved electives is now open to receive applications. And then at whatever medical center for an emergency medicine acting internship or a sub internship or whatever you want to call it, this is what that's going to look like. You want to apply to this as soon as possible, as soon as you get this email. So, some commonly asked questions. How many should I apply to on VSLO? I would say no more than 10. Save your money. It's like 15 per application. And honestly, some places like Emory in Atlanta, so I'm from Georgia. Emory from Atlanta has an additional $150 application fee to go and do their audition rotation. So, read the fine print on some of these, but don't apply to more than 10. I think that's more than enough to get like two or three. When do you need to apply? Again, the day the rotation opens. As Nicole was saying, do it immediately. Very important. Can I drop an elective or will I get blacklisted? You can drop it, just make sure to give the correct amount of time, at least 2 months out. You're going to have plenty of time to cancel these things. Canceling last minute would probably look very bad to the program. But as long as you email the coordinator, explain why, make sure you're doing kind of your due diligence there. And then if you get accepted with conflicting dates, you can obviously email the coordinator. A lot of these places can have you do like 2 weeks, and then split and then do another 2 weeks. So if you absolutely have to have two that are kind of during the same time, then they're pretty flexible. So this is the map that is on EMRA Match, and there are, and I updated this, 285 emergency medicine residency programs. That's a lot of programs all over the country, and for some reason, a lot of them are in New York. But uh, there are so many programs. So to look at all these programs, again, you can use EMRA Match, which actually has the map, which I found to be really, really helpful because I was kind of looking at places based on geographic range. And so being able to see exactly where they are and have a little tidbit on like, what level trauma center they are and all those like stats on like how many patients they see and all these sort of things. It was really good to look at. Um, and then I also used a little bit of the Residency Explorer tool. Like say if you found one on Emmer Match and then you're like, I want to learn a little bit more about that residency. You can go on the Residency Explorer tool, which is free through the AMC, and then you can learn more about that program. So what should you look for in a program? So 3 year versus a 4 year program. Now, this will be changing as soon as next year. So eventually, every EM program will be a 4 year program. Now, I don't know if that's next year or the year after or the year after, but this is going to be changing soon. Everything will be a 4 year. It may not be for you, but it will be. Uh, then we have academic hospital versus community hospital versus county hospital or program. Academic, I'm going to show a pie chart later, kind of telling you a little bit about the differences between the three, but it's kind of intuitive. Academic is going to be more research focused and more, less patients but higher acuity and have a ton of specialties that are there that are in-house and you have everything available to you. Community is kind of like a happy medium, where you have a lot of specialties available to you, but maybe not as many like residency programs that are there that are trying to steal your procedures. And then county, which is going to be your kind of down and dirty, you have to do everything hospitals and programs. Like you're the one who's pushing the patient to the CT machine, or you're the one who's having to start all the lines, even the and acubital lines. So do they rotate at multiple hospitals? Very important. Driving sucks. So driving long distances to places is not the best, where do they do their peds rotation, that sort of thing. Fellowship offerings. How many fellowships or what fellowships do they have? Does that match what you want to do do you just want to graduate in 3 years or 4 years and then move on to do emergency medicine as an attending, or do you want to pursue a fellowship? How much time do they spend off service? So how many rotations do they have where they're not in the emergency department? Shift length, which is a big deal, at least in my opinion. Are they 8 hours? Are they 10 hours? Are they 12-hour shifts? 12-hour shifts are pretty brutal. But if that's more your speed and you think you want to do less shifts but more time, this may be where you want to go. Number of shifts per month. So again, that's kind of going to be tied into the shift length. Are they month blocks or 28-day blocks? Longitudinal pediatrics exposure. How are the traumas run? Are you the one who's going to be in charge of the traumas, or is the trauma surgeon, or what are you going to be responsible for during the traumas? Pay and cost of living, moonlighting opportunities, whatever else is important to you. And these are kind of big ones too. Don't go to Utah if you don't like to be outdoorsy. Don't go to New York City if you don't want to live in a big city. Don't go to the middle of nowhere if you can't do without pro sports, or you can't do without kava, or you can't do without a Starbucks. Don't move across the country if you want to see your family every weekend. Important things, important things. So this slide I'm just going to kind of leave up for a moment because I kind of already went through the differences between community, university or academic and county. So I'll let you kind of peruse this for a moment and I'll ask kind of right now, does anybody have any questions so far?
I had one. I'm in my surgery rotation right now, and it's really to show me that like how much I do value procedures.
Mhm.
And I have friends at different residency programs. One is completely unopposed trauma. They do everything until the patient gets in the OR.
Mhm.
And at the program I'm at right now, when I went through the ER, they're just holding an airway.
Yep.
How do you find out this information? It's not really available on websites.
Yeah. So I have actually asked this question on pretty much every interview. that I've had.
Okay.
And a lot of times, if you ask the residents that question, they will give you a straightforward answer. So a lot of times when you're doing an interview, you have like three attendings that interview you that are like, program director, associate program director, education director, that sort of thing. But you
Mhm.
have a resident that also interviews you. And you ask the resident, they'll give you a straightforward answer about that.
Okay.
And that's the only way to really figure it out if you are not rotating there. So, like, if you do a rotation there, obviously you're going to be able to figure that out. Another way to kind of get a glimpse and kind of see maybe is this the case is if you look on their programs, where they rotate at that hospital, see how many other residency programs there are. See if there is general surgery, see if there is orthopedics there. And if there's residents there, generally you might be competing
Okay.
for procedures.
Okay, but really the best chance is during your interview. So like as a third year right now, like looking forward to rotate at certain places,
Mhm.
kind of can't really find that out unless you know someone there.
Yeah, yeah. I mean, does anybody else have any suggestions, Nicole or Manny?
Yeah. So if you go on to Frida, it was one of the websites mentioned earlier. I sent a screenshot of just some of the EM programs in Florida. They
Okay,
kind of
so
give you an idea of what they are. So, for example, in the one I just sent, it said the one in the middle, it says university academic, and then the one above it says community with a university affiliation. So it's kind of a hybrid between the both. Does that make sense?
yeah, and I guess those kind of coincide with how much ownership, for lack of a better word, you have over trauma cases.
Mhm.
It
Seem
would
like
just
I'm a
be
trauma junkie, but it's important for hands-on stuff.
100%. Um,
100%. So I just sent the link to Frida as well, so you guys can just use that to look at it as well.
yeah. Nicole, you got any suggestions?
I would argue that it's very different, like based off of wherever you are. I wouldn't go solely off of like academic versus community versus county. I do think if you are like really interested in a place, there's nothing wrong with like reaching out to like their Instagram account. Typically, those are all resident run,
Okay.
or like trying to get in contact with one of the chief residents. Those are typically listed on their website and their emails are typically listed. Like if it's something that's going to make you make or break picking an audition location,
Hmm.
I don't think it hurts to like reach out and be like, hey, I really like your program. I'm just wondering how you guys run your traumas. Are they split side of bed? Are they split day of the week? Are they split odd or even day? Or do you guys fully run them? Are you just airway? I'm just trying to figure out kind of what that looks like before I apply for an audition. I think that's probably the best way to go about it than like assuming like, oh, this is academic, they do nothing because Emory, which we've mentioned before, is a highly
Yeah.
academic program. Their traumas are like very much so led by a lot of ER residents, even though it's highly academic. So I would err away from assuming how a trauma is run based off of what type of program it is and just ask. It's probably the most heavily asked questions during interviews because it's something that a lot of people love to know about.
Thank you so much.
All right. So we'll get moving. As we were just talking about, trauma. So if you look at this website, it'll bring up the different kind of trauma levels and what exactly that means. And what exactly that means can actually vary from state to state. So make sure that you know what exactly your state that you're going to be practicing in considers a level one trauma or considers level two or level three. One of those differences, actually, something I learned pretty recently, is that the only difference between a level two and a level one in Florida is the fact that in level two, they do not participate in research. That doesn't mean that the EM program does not participate, but they don't participate in trauma research. So anyways, as Nicole was talking about, this is kind of the setup that you might have during your time in the trauma bay. You have airway, which is generally going to be the EM resident if they're not running the trauma. And then you have your team leader. Faculty is just kind of off in the corner, just kind of leaning against the post and kind of checking in and making sure everything's running fine. You have your scribe, whoever that's going to be, your nurses, RT, who's, you know, constantly like, are you going to tube them? Are you going to tube them? Are you going to tube them? And anyways, this is kind of the setup. But let's talk about creating your rank list. This is going to
Bradley,
begin.
we have a question in the chat.
Sure thing.
A lot of our current fourth years talked about how overwhelming it felt to rotate through an academic program, especially since all of our third year rotations are at community/county.
Mhm.
Do you have any tips on how to succeed in an academic hospital audition without any prior experience?
Man, I gotta tell you, I actually have not rotated through a big academic center. So, Nicole, do you have anything?
Um, I think one of the greatest things about EM is that emergency medicine is emergency medicine. I think if you show up with a good attitude, no matter what, like academic community county, no matter what kind of program you're showing up to, I think that's one of the biggest recommendations I can ever give anybody is just show up with a good attitude, excited to learn whatever you can and to be as helpful as you can to everyone on the team. Um, I genuinely don't think that there are like tips specific for the academic center. I would say maybe brush up on like talking to your consultants and things like that. They tend to be a little bit let's see, how can I say this, less collaborative with medical students. Um, so just knowing that like when you're talking to like these super specialized consultants, they are a little less happier to answer the phone sometimes. But I do think that like there's nothing really specific else to really prepare yourself from like an academic center. Like you'll as you guys go, you'll see like EM residents are EM residents. They are people that you're going to get along with when you get there. My biggest tip is always just show up with a good attitude and like be willing to help every person on the team, help the nurses, help the resident, do everything you can to be the most helpful. That like shines tenfold more than the person who knows every little nitpicky thing and all of the medical knowledge. I would take the happy, helpful student over the I can get every step question right student every day of the week.
Fantastic advice. Yeah, I mean, completely agree. Even something that I did on some of my rotations is I would carry around literally extra pens just in case any of the attendings needed it. And honestly, I got more compliments kind of doing that sometimes than I did by answering their questions right. So, it's just kind of like it's a show that you're willing to put in the effort.
Be the person who
Um,
cleans the ultrasound, gets the
ooh, yeah,
blankets, gets water if the patient can have water. Like be the person that make your residents shift easier. My biggest tip ever.
very, very true. So, let's talk about creating your rank list. So, this is going to be in February of our timeline. You want to start with your gut list, places that you feel like you would fit in best. You know, where do you see yourself being the most happy? Then you kind of want to make sure that your number one is truly your top choice by refining by some other objective factors like case volume, location, lifestyle, fellowship, shift structure, all those things that we kind of said, what should you look for in a residency? Those are your refining factors. But obviously, start with the gut. Where do you think you're going to be happy? And also, the match is a very resident medical student oriented process. So there is no advantage to ranking a program higher unless you genuinely want to go there. So that doesn't mean, oh, you know, let's say, since we're harping on Emory, Emory is a super prestigious program, and so I'm going to put them number one. And then if I don't get in there, okay, but I'll have it my number two, my place that I actually feel like I'll be the happiest. But number one, I want to make sure that it's, really competitive. So let's put that number one. And then you end up going to that program and then you end up hating it. It happens. It happens. So make sure that your number one is truly your top choice because a lot of people do get their number one. Now, common mistakes to avoid. What I just said, kind of ranking based on where you think you fit in their rank list, ranking based on other people's opinions or that big Reddit document that's out there. People who put things on that big Reddit document, they may be completely true, but they also may feel very strongly about a program that they feel wronged them. And so they may not put it in a bright light. Uh, don't let a single day overshadow the program quality. So, like, if you had a difficult interview, or if it was like snowy weather, or you can have a day like today where I spilled coffee all over myself right in front of the attending. Uh, don't let a bad day overshadow the program. So, don't overvalue academic prestige as well. Go where you're going to be happy and where you think you're going to receive the best training. Now, that's not necessarily at the place that has the most academic prestige. And do not ignore your other factors: location, lifestyle, support network. Residency is hard wherever you go. So make sure that you set yourself up to be able to endure. And I want to end with a quote. One learns from books and example only that certain things can be done. Actual learning requires that you do those things. And so this is your time. Go out, do well, learn. And that's it. So at this time, I would like to plug our spring seminar. This is going to be at Los Portofino Bay Hotel in Orlando, Florida. It'll be April 19th through April 23rd, and I hope to see all of you there.
RSO dates are going to be Monday, April 20th and Tuesday, April 21st. We have a lot of great lectures. Thomas Creech and I are the two conference chairs where we do the lecture planning. We have a lot of fun things coming up. Just to give you guys a little teaser, 2 words, Florida man. Have fun with that with what you will. And then I'd also like to plug in Emily if she wants to give a little shout out